Oh, 36 minutes. Buckle in, boys and girls. This is gonna be a long one. Hi everybody, my name is Ellie Iger. I am an eyeball person, a COA, or a certified ophthalmic assistant, if you will. I am certified through JCAPO, which is the Joint Commission on Allied Health Personnel in Ophthalmology. Today I want to talk to you a little bit about refractive errors. A refractive error basically means that the shape of the eye or the shape of the cornea is not able to bend or refract light correctly, which causes blurred vision. This can generally be corrected using glasses, contacts, or surgery. There are four main types of refractive errors, the two biggest ones being myopia or nearsightedness and hyperopia or farsightedness. Myopia generally affects about 23.9% of the population, whereas hyperopia or farsightedness is estimated to affect more than half of the population, but this does account for presbyopes as well. Presbyopia is something that we've talked about in a previous video before, but presbyopia is just basically age-related farsightedness. So your near vision gets worse as you get older. The last main point would be astigmatism. Astigmatism is something that I see a lot of people online being very confused about, and it can be quite difficult to understand in the way it's explained from certain places, but it's basically just a distortion of the light that's entering the eye. Now, with these four main groups, you can have more than one. You can be a myopic presbyope, you can be a hyperopic presbyope, you can be a myopic astigmatic presbyope. Try saying that 5 times fast. But you generally can't be a myopic hyperope. You can't be a nearsighted, farsightedness type person. It just doesn't work that way. Or if it does, that would be considered presbyopia. A myopic presbyope. Now, the AAO, or the American Academy of Ophthalmology, does estimate that over 150 million Americans wear some type of corrective lens. And this translates to over $15 billion spent each year just on vision correction alone. It is important to note that about 15% of the population is estimated to either need glasses and not wear them, or actually not need glasses. Fun fact, the condition of not actually needing any kind of correction in order to see perfectly is called emmetropia. This is actually very, very uncommon. So let's talk about nearsightedness, because this is something that I'm very familiar with. As you can see, I am very nearsighted. You can see the way my glasses shift my face inwards. It's because the curvature of the lens is that strong, and it has to be in order for me to see clearly far away. Without my glasses, I can kind of see a couple inches from my face, if that. Now, myopia generally forms in your childhood years, but it can get worse as you get into adulthood. The average flat line for myopia, where it tends to stop getting worse, is around the age of 20. Sometimes it can extend a little past this, sometimes it happens a little earlier if you're lucky. I was not, but that's the general consensus. There are such things as shifts in your refractive error, so especially myopic shifts generally occur with different health conditions such as diabetes, arthritis, and any uveitic inflammatory disease. Myopia does come with an increased risk of retinal detachments, glaucoma, and cataracts. Because in myopia, the shape of the eye is longer. As myopia progresses and gets worse, that eye gets longer and longer, and it becomes very unstable. People who have high myopia or anything considered over like a +7 or a +8, that's when we really start to worry about their retina. It has also been found that low-dose atropine drops can help to slow the progression of myopia in young children. So especially for children that are already born quite myopic, the doctor might consider starting them on a once or twice a day atropine regimen in order to keep this condition from getting worse and thus compromising their retina at quite a young age. The next topic we're going to talk about is hyperopia, or farsightedness. It is said that most children are already born hyperopic, and they may require some glasses to help them see during these years, but they can generally grow out of it. Hyperopic shifts are more common after the age of 40, when you're leading into the years of presbyopia. So someone who is already very nearsighted may actually see a decrease in the prescription strength that they need because they're shifting more into that presbyopia age. There are less risks associated with hyperopia, but they are focused more intently around children. Children that experience high hyperopia may develop eye crossing problems, eye strain, and quite often fatigue. Then we have presbyopia. Presbyopia is that weird time in your life where you start to need reading glasses or bifocals. Generally happens around or after the age of 40, and people who are already nearsighted are going to notice the effects of presbyopia much later in life as compared to people who are farsighted, who are going to notice that their near vision is getting worse and worse because it's already not as good as it would be with someone who is nearsighted. And presbyopia is caused by the hardening of the lens inside the eye. And in my first video, I talked about how I like to think of the eyes like silly putty. It's bendable, it's malleable, it changes its shape in order to focus the light where it needs to get to in order to see properly. But after the age of 40, it kind of shrivels up. It doesn't really shrivel up. It hardens, basically. Someone left the cap off of the silly putty, and now it's just a rock. And then finally, we have astigmatism. I'm going to describe this in the best way I possibly can, and it's okay if you still don't understand it, but please know it is not a disease. It is not anything you should be worried about. 1/3 of the population has it. It is nothing to be concerned about, but it is something that should be corrected if you do have it. Astigmatism is defined as an imperfection in the curvature of the lens of the eye or the cornea of the eye. So where we have hyperopic eyes that are flatter curves of the cornea, and myopic eyes that are steeper curves of the cornea, in astigmatism, the cornea is not perfectly rounded on all sides. It's almost more like football shaped. So the light that's coming through the eye is distorted in two separate ways. Now, like I said, this condition is extremely common, and doctors are not quite sure why it is quite so common, but it is believed to be genetic. Now, you can go your whole life without having astigmatism, but it can be induced by certain things like diseases, injuries, and surgeries, especially to the eye. And it is also a very large myth that astigmatism is caused by reading in low lights or by sitting too close to a television. These have not shown to impact the amount of astigmatism that the eye contains in any way. So what does this all mean? Basically, it just means that you need help with your vision. Glasses, contacts, surgery. So let's talk about that. The first thing I want to talk about when it comes to correction is the obvious one, glasses, or specifically lenses. Because frames are great. Trust me, I know. I've got like 40 different pairs of glasses. I'm just a total slut for them. But they don't really impact your vision at all. It's the lenses that we need to be most worried about. As far as lenses go, the first one to talk about is the OG lens, the glass lenses. These were originally hand surfaced, and they're very heavy, they are scratch resistant, but they are also very dangerous because they can shatter. Nowadays, they also tend to be quite expensive because not every laboratory has the ability to safety test these glass lenses like they are required to do nowadays before they send them out to the patients. So if you're looking to get glass lenses, be prepared to pay a higher cost and wait a longer amount of time so that all the safety testing can be done. Next up are plastic lenses. These come in a variety of different densities and indexes to help reduce the thickness and the weight of the lenses. They are easily scratched and they are able to be shattered, but they are generally the cheapest lenses on the market, or at least basic plastic lenses are. The lower the weight and thickness of the lens, the higher the price is going to be. And then finally, we have polycarbonate lenses, or what is commonly called the safety lens. These lenses are generally thinner, more lightweight than basic plastic. They are also scratch and shatter resistant, though they are not scratch and shatter proof. We get a lot of complaints about patients that come in to our office. They've paid the upgraded fee for polycarbonate lenses, and here they have a scratch on them. It happens. If you're not careful with your glasses, you're gonna scratch them. Speaking of upgraded fee, these do tend to be a little more expensive than basic plastic lenses, but like I said, when you're getting into those thinner, more lightweight plastic lenses, the cost skyrockets. So you have basic plastic on the bottom, polycarbonate in the middle, and then on top, the most expensive lenses would be those high index plastic lenses that are made for people who have much higher prescriptions. Polycarbonate lenses do come with a little bit of a catch though. There is such a thing as being polycarbonate non-adapt. This is a term that we use in the eye world for patients who are not able to get good clarity of vision when looking through polycarbonate lenses. It's found mostly in patients that are used to wearing plastic or glass lenses for many years and is caused by aberrations in the optical quality of the lenses. When I was an optician, it was forbidden to take anybody out of a glass or plastic lens and put them into polycarbonate lenses, because 9 times out of 10, you're gonna just lose your money that you're getting from selling these lenses, because you're just going to have to redo them because the patient unfortunately may not be able to wear them. Because polycarbonate lenses are said to be the safety lens, they are the most recommended lens for children, people who have a bad eye, are missing an eye, have different eye problems. Any type of safety requirement is going to recommend that you have polycarbonate lenses. So moving on from the most basic of eyewear to the a little more in-depth eyewear, you have contact lenses. The biggest problem people tend to have with contact lenses is fear. Nobody wants to go touching their eyes, and that's understandable. Men generally do have a harder time putting contacts in than women, because by the time women are starting to wear contact lenses, they may have already started to wear makeup, they're used to being around their eyes, it's not quite as daunting. The second biggest problem that we see with contact lenses is handling. Contact lenses do require a lot of care and consideration. There are a lot of steps that go into taking care of your contact lenses, and you and your doctor should have a very, very in-depth conversation about how to go about the handling of your contact lenses. The third problem we see with contact lenses are biological issues. Patients who have dry eye oftentimes have a hard time wearing contact lenses, such as myself. It is also possible to have an eye that unfortunately just does not fit the range of contact lenses that are out on the market today. Most contact lens brands come within a set range. Now there are hundreds of them out there, but they don't often go super low or super high. And if they do, they're very expensive. The biggest key that I want to hit on here is that contact lenses are not one size fits all. They are considered a medical device by the government, and they are very, very heavily regulated. I always tell my patients, if they're going to buy contact lenses online, that they really, really need to be careful about the companies that they're trusting with their eyes. You should never trust a contact lens delivery service or contact lens provider that does not require a doctor verification for your prescription. It's called a prescription for a reason. You don't go to the pharmacy asking for amoxicillin when you were prescribed penicillin because you might be allergic to amoxicillin and your doctor prescribed penicillin for a different reason. There are so many complications that come with ill-fitting contact lenses, it is mind-boggling. I mean, you have things like corneal abrasions or eyeball scratches. You can be allergic to the material of the lens. You can be allergic to the solution that it comes in or the solution that you buy at the store. The biggest problem with solutions tends to be the preservatives that they use to keep themselves fresh. Another problem we see is neovascularization, or the formation of new blood vessels to the cornea. So you have an ill-fitting lens, especially a tight lens on a flat cornea, and it actually strangles it. It keeps the cornea from receiving the oxygen that's carried to it by the little blood vessels around your eye. So your body thinks, oh, I'll just make some new ones, no problem. But it does tend to be a problem. It can cause a lot of issues, and it is not something that you want to have to deal with. One of the most common issues with ill-fitting contact lenses or improper handling of contact lenses is called GPC, or giant papillary conjunctivitis. I am going to add a picture here, but here's your warning that it's not pretty. GPC generally comes with these papillary glands that are inflamed or infected, and this requires you to not wear your contact lenses for sometimes 2 to 3 weeks, sometimes ever. And a lot of doctors, a lot of practices will also refer to this as contact lens overwear syndrome. The eye is just not accepting the lens any longer. The last complication is really one of the most dangerous that we see in our practice, at least. But corneal ulcers are very, very common with improper contact lens fits. Ulcers that form on the cornea because of a lack of oxygen especially. So the material that contact lenses are made of is a permeable material. It can take oxygen from outside and let it through to the tissue of your eye. If that material is not, for some reason, functioning well with your body, is not allowing the oxygen to move properly, then you get these lesions on your cornea. They can be extremely painful. They can have high rates of infections and scarring, and we've also seen patients that have needed corneal transplants because of a ill-healing corneal ulcer. And it's really sad to see something that could be so preventable turn into a lifelong struggle. Of course, contact lenses also do come with an increased risk of eye infections, conjunctivitis, and pink eye because you're touching your eyes. You're touching the lens that's going in your eye. You're oftentimes using your fingers to hold down your lids, hold up your lids. There's a greatly increased risk of infections if you're not careful. And not only that, but contact lenses are like little sponges. If you get them wet, if you go swimming or you shower in them, any bacteria that thrives in that water, especially tap water, is going to attach itself to your lens and just breed. Contact lenses also tend to be one of the more expensive options when it comes to vision correction. There are certain brands that are more cost effective, but they can get pretty pricey. The corneal specialists that I work with tend to recommend a lens that is about $1 per lens. So you take $1 per lens times 365 days a year if you're going to wear them all year round, and then you multiply that by 2 because you have 2 eyes. And you end up with the grand total over here, which you could probably cut down to 1/4 for a pair of glasses. They may not be great, but they'll get you by. And if you're really in a pinch, contact lenses generally are not the way to go. Fitting contact lenses is also quite an expense. The company that I work for, and even the company that I worked for prior to my current employer, they always charged extra for new patients coming into the contact lens world. This is because it's going to require more than one visit to get everything kind of settled. You don't just go into a doctor's office fresh and leave with some contact lenses. That's just not how it works. Contact lens fitting is not an exact science, so sometimes we have to try a couple different brands till we find one that you like. You take it home, you try it for a couple days, you come back and let us know how it feels, and then we can set in stone for your prescription. Sometimes it takes multiple of these different tries to get a solidly comfortable lens for you. Not only that, but it is also our responsibility to teach patients how to put their contacts in, how to take them out, and how to take care of them. This is quite a lengthy process, and it is quite a discussion to have with patients to make sure that they understand the responsibility that they're getting into when they sign up for contact lenses. And contact lenses are really only appropriate when the patient is responsible enough to handle them properly. Every single time a patient comes into our practice wanting to inquire about contact lenses, our doctors are forced to sit down with them and talk to them about some of the responsibility. And really, it's up to the doctor to say, yes, I will do this, or yes, I will not. Some doctors don't care, unfortunately, and will do it because they get your business out of it. But a lot of the doctors that I work with are very caring about this, and they're not going to do something that they know is not going to work for you. On that note, I want to talk about refractive surgeries. Now, in no way am I any kind of expert on refractive surgeries. My office does provide refractive surgeries. I'm not generally a part of that discussion, but there are some things that I do know about the refractive surgeries. These are things like LASIK, PRK, RK, and they're generally meant to help fix your vision in the long term so that maybe you won't need to wear glasses or contacts. Most refractive surgeons will offer a free consultation for you to come in and get evaluated on whether or not you are a good candidate for refractive surgery or not. During these visits, we look at things like age, corneal thickness, expectations. There's a lot that goes into the consultation in order for the doctor to make an informed decision about whether or not you're a candidate and which surgery would be best for your eyes going forward. Refractive surgeries carry risks just like any other surgery. Most of the risks involve under or over correction after surgery, so you may still need to wear glasses or contact lenses. You can experience a change in vision long after the surgery, and a lot of patients do also experience advanced forms of dryness or dry eyes after they have surgery on their eyes. Now, please be aware that there's no good answer if you go to ask what works best for me. That's something that you and your doctor should sit down and talk about, because there are many different options out there on the market for you. And if you're having a problem with your current correction, then talk to your doctor and see if there is another route for you to take. But that's everything for this video, friends. I hope you enjoyed it and that you were able to learn something new today. If you have any questions, please feel free to drop them down in the comments, and I'll see you next time. Bye-bye! You're not special. I shouldn't say that. That's rude.